Dan, wanted to talk about his experiences in healthcare, especially over the last couple of years. So maybe, Dan, you could share some of that. So what's been happening with you and these various companies over the years?
Well, I mean, just in terms of going back to my childhood, my dad worked as a van driver for the New York City Health Department, and back in the 1960s and 70s, our day-to-day medical expenses were paid for by the New York City Health Insurance Plan called HIP. And in fact, the building was an orange-covered building, very 70s looking, right on Jamaica Avenue. It ended up like 160th, 165th Street, somewhere in there. Then hospital coverage was Blue Cross Blue Shield. And my dad, when he retired in 1978, 78, he would have, or 79, he would have been 62. He retired, and I think he was making like 11,000 at that time, which would probably be about 35, 40,000 today. But when he retired, though, the medical insurance did keep on for me and my sister until we hit 18, and for my mother until for quite a while, because it was part of the pension. And in those days, pensions were not only payouts, but if you were in a union, like my dad was in DC District Council 37 union, which was one of the biggest labor unions for the city of New York back then. They also paid for medical insurance up until children reached the age of majority, and for widows for, I guess, until they died. So my mother had that for most of her life. Then I worked in assorted jobs. I've been in 4 unions, and most of their medical benefits, like when I worked for AT&T or for this company called Finest in New York, they had pretty good medical benefits. I'm now currently on my wife's, Jessica's, insurance. She works for a biotech firm, and it's decent, but it's nothing compared to what my dad had years ago. The companies, when I have worked for them, before we were talking, I mentioned I got a hernia now that I'm going to have surgery in a few days. The company I work for, I've worked there 3 years. I've been injured 3 times because of their negligence. First, I had a partly detached retina because I got socked in the eye by something at work, and the company determined it wasn't. They didn't determine it wasn't their fault. I only started showing symptoms of the detached retina 6 months afterwards, and you have to show symptoms within 60 days before they'll consider covering it. So they didn't pay for that and the subsequent surgeries, 2 surgeries on this eye and the surgery on this eye. Then I had a broken foot.
You had to do that out of pocket for the surgeries?
Yeah. And then I had a broken foot. And the only coverage they had was I went to a doctor a couple of times, a real doctor. And the only reason they covered that was because it was actually on video camera and they saw the negligence, which was obvious. And then this hernia, I had a hernia at another company I worked for back in the middle 6 or 7 years ago. And that company was going to pay for it, but they sent me to a doctor who was a total quack. And I said, I'm not letting this idiot cut me open. So they said, well, if I wanted to go to another doctor, I had to pay for that myself. So given the choice of going to a guy I was not comfortable with taking a scalpel to me or paying for myself, I paid for myself. Then the company that I got the hernia just on January 4th this year, this company, the third time, they took about a month to decide that they weren't responsible because, naturally, since I had a hernia with another company on the other side of my body, this somehow was supposed to be related. Of course, it's nonsense, because that's like saying if I broke this hand 10 years ago and I broke this hand last week, they're somehow related. It's totally ridiculous. But that was their way out of that. And the thing is, the company that I work for now should not have any right to look into my medical records. But they would not even think of covering it unless I signed off to let them look at a prior medical record. So this is a way that they hold you hostage and screw you over in that manner. And so now, I'm going to have to pay for this hernia surgery. It's hopefully it won't be as painful as the first one, because now they're using a robot to do it. But it's just one of the many ways that they're screwed over. And this company, in another This company I work for now is the only employer that has never automatically provided disability insurance. When I worked for the other company and I had the hernia, I was able to take off 2 weeks and get paid at like 70% with short-term disability. This company doesn't provide short or long, or they do provide short or long-term disability, but you have to submit to a test. But because I had a broken foot and because I had the eye thing caused by this company, they then use that as saying, well, we're not going to give you longer short-term disability because you're injury prone, even though it's their negligence that caused the first two things. So very similarly to what I said earlier about the way companies rationalize things, and they'll fire someone if you speak up and you're a whistleblower. If you get injured by a company's negligence, they'll use that as an excuse to keep further medical care from you later on.